I spent 10 years of my life addicted to prescription painkillers, and the only thing that saved me was endurance sports. I've run 10 miles every single day for the last several years. Rain, shine, snow, hurricane, didn't matter. Now at 54, I've won an age group marathon world championship. I'm in the best shape of my life, and today I'm gonna find out if I'm as healthy as I look. So today my heart's gonna get checked by Dr. Jeremy London, one of the top heart specialists in the world, and I'm nervous as hell, but we're doing this. All right, we're in Savannah, Georgia. I'm here with my good friend, Dr. Jeremy London, cardiac surgeon to the stars. We're getting a calcium scan on my heart, and I'm also getting an MRI on my prostate. I've been having frequent urination problems. Comes with the territory when you're almost 54 years old, so Dr. London's gonna get me sorted out.
We're gonna take a quick look at Ken's heart. I suspect there's gonna be very little calcium buildup, and a peek at the prostate, it's gonna be tiny.
Oh, so nervous.
How are you, man? Good seeing you.
You too. Jack Considine.
Pleasure. Good to meet you.
Ken Rideout.
How you doing?
I'm so nervous that I'm gonna have some health problems that I'm like giving myself an anxiety attack.
So Jack, we're gonna do calcium scoring CTA and then MRI of the prostate.
Oh, we're gonna do that?
Yeah.
Oh, okay. I'm gonna have to check that one out.
I'm more concerned almost about my prostate because I've been like having these frequent urination problems, and I've had PSAs done and they're all normal, but I'm like super nervous.
So this is the CT scanner. You notice it's not closed in. You just go through the donut. It's not like you have to worry about claustrophobia or anything like that, and it's really fast. It'll be 10-15 minutes and he should be in and out, and it'll give us all the information that we need to assess his overall cardiac risk with a relatively non-invasive test.
So what's your first name?
Ken, K-E-N, Rideout, R-I-D-E-O-U-T. Do I need to take any of this stuff off?
You're good.
Oh, okay.
We're gonna do a calcium score. It's gonna measure the calcium density in his coronary arteries and give us an idea if he has any increased risk for a cardiovascular event or cardiovascular disease. And what she's doing now is she's hooking some cardiac monitors to him, and we have to monitor the heart rate when we do it so we can gate the heart as it's beating, and it gates within our software, so when we do the scan, we don't have motion, and we get clean images of the coronary arteries and get accurate calcium measurements. What we're looking at is to make sure he doesn't have any underlying disease that would increase his risk for cardiac events. So really what we want to know is how much calcium burden or plaque does he have in the coronary arteries, and then I'll explain to you in a little bit about how we use a score to determine if his calcium is normal or abnormal for his age, and if he has an increased risk of an event. And then if he does have an increased risk, and that gives you an opportunity to do a couple of things. Monitor your lifestyle, okay? Monitor your dietary intake, etc. And it also gives you the opportunity to go on statins if you need to control your cholesterol levels via statins. So that's the two main things that it's going to help us determine with them. It can be genetic, it can be dietary, it can be associated with sedentary activities. So there are a lot of different causes, and that's the beauty of this, is it gives you an opportunity to identify if your calcium burden is elevated so that you can modify those risk factors. You may already have pre-existing risk factors like family history of coronary artery disease, okay? That's important. You may have done genetic profiles through executive screenings, et cetera, that say, yeah, you have this genetic predisposition for coronary artery disease, but what this is going to do is tell you, do you have the physical signs that you can see that you actually have the effects of those things. Now, just so you know, on the IV, the first part is probably very important, that when you have a regular calcium scan, any patient that goes to get a calcium scan, you don't have to get an IV, you don't have to get contrast, okay? It's a scan without anything. The only reason we're doing this on him is because we're going to do a coronary CTA afterwards. And that's when we inject non-iodinated contrast into his vein, and it's going to give us an entire reproduction of his coronary vascular system. All right.
I feel so vulnerable.
You are. Honestly, I've had multiple friends of mine that are physicians that have come in and had this study done, and they're getting a cath and stents placed that week, within the next day or two.
You're kidding.
No, multiple. One of my best friends growing up in high school, about a month or two ago, came in, ended up with a triple bypass 2 days later, after having a calcium study done. So
It's just strange. Over the last year or two, I've just been waking up to urinate so many times a night. But then I had the PSA test done, and they were like, "No, everything looks normal." But I'm like, something is going on. But it doesn't necessarily have to be prostate. But I'm like, I just want to get it checked to make sure.
We'll discuss that in a little bit. But the most common cause of that is BPH, benign prostate hypertrophy, very common. Is that all right? Okay. That's it. Did a whole, I mean, pretty amazing, isn't it? Considering you used to have to go in with a catheter through the groin, up into the heart, drop it in each vessel, do specific injections and runs, and now inject it into a vein, scan the whole friggin' heart. This is so good now, as you'll see when we do the recons and all, that it's really been a game changer.
So much fucking anxiety.
Second, she's going to pull up the images, and we're going to show you how we get the region of interest and how we create these calcium scores. Super simple.
How'd it look?
Your score should be pretty low, so I don't think that's going to be an issue.
Perfect.
But just on a quick pass, it looked pretty good, but we got to get it upstairs to see.
Gotcha.
Yeah, for sure. Get it on the high-res monitors.
All right.
And what she's doing now is she draws regions of interest around each main vessel around your heart. And then after that, you put it into the hands of the algorithm. What the algorithm does is it measures the diameter of every plaque, and then it multiplies it by a density score. So we see how much attenuation the calcium have, which basically means how dense is the calcium. And the more dense, the higher the score. So your multiplier may be 1, 2, 3, or 4. And suppose it's 400 plus on the attenuation, you multiply it by the diameter of a plaque, say it was 8 millimeters, and the score for that one plaque would be a 32. Then you add all those scores together, and that's your total score. And then what we do is it's gonna reference you against age match controls. So your sex, your age group, and then it's going to determine where you fall in that spectrum and what your risks are. The bottom line, the higher, the greater risk. You get up over a 400, then your risk of a significant cardiovascular event in your life is extremely high.
Fuck.
But you're not there, but that's
okay.
why we do this.
All right.
I mean, you have a little bit of plaque. It doesn't look bad, but we don't know till the computer does its magic. So that's
Gotcha.
what's happening now.
Okay. Oh my God, I'm so effing nervous.
Easy for
only
two things.
71?
71.
Is that good?
You have some calcium in your left anterior descending. Your score of 71 places you at the 60th percentile. It means 40% of male ages from 50 to 50, 51 to 55 will have a higher calcium score than you.
Damn, I'm in the-
But if you go back, this is still, it's not a high number. I'd be happy with that score.
Really?
Yeah, very happy. If you have a lot of plaque, like older people do,
Yeah.
in general, you have a lot of plaque. It's kind of like a stream that's been around a long time, and
Yep.
trees are constantly falling,
Yep.
so the stream forms little collaterals around it.
Yeah.
When you don't have a lot of plaque, and all of a sudden it's a perfect stream and a big tree falls and blocks the water completely, no water is getting downstream.
Yeah.
And I think that's one of the reasons that elder patients often do really well. Well, not really well, but they may have an infarct, they may have a heart attack, but it doesn't affect a huge territory. And really what this is doing is it gives an opportunity for two things, really. One is lifestyle modification, diet,
much-
exercise, etc.
How easily do you think I could lower that score? And what do you think I could get it down to?
It's not going to lower.
And there would be no reason to focus on lowering that.
Do you recommend statins or not so much?
I think that's individualized, right? I mean, I
Because
think
they
that-
suggested
And
one
that's-
for me when I got my lipids, and I said, nah, I don't want to do it.
Well, that's one of the benefits of this. Like, say, lifestyle modification. Number two, do you go on statins or not? And that's
Yeah.
what a lot of doctors use this for.
Sure.
Is the patient a candidate for statins? Should they
what's
be on
your
statins right
thoughts
now?
on statins?
Ken?
I got just enough time to get him done right now. Let's
do it.
Come back to him later.
Let's go.
Do it.
Okay.
What's Ken doing right now?
He's having a prostate MRI, and we're going to check out his prostate. And it's going to give us a good idea of a couple of things. But number one, the shape. Number two, the size, which is real important. Number three, the morphology of it. Okay, where does it morph into what areas? And then lastly, and most importantly, we'll give him some contrast as well, and it's going to help us determine if there's anything that would be suggestive for malignancy in there for prostate cancer. So that's the goal here, find out if there's anything suspicious. If there is, get him in the right hands to have his prostate evaluated.
First of all, why is heart disease even important? Well, it's the #1 killer in the world of both men and women. 20 million deaths a year. So to be heart health conscious just makes good sense just based on priority. And obviously there's lots of factors that go into creating a healthy regimen to maintain a healthy heart, but it's based on things that we already know. Eating a whole foods diet, limiting or eliminating processed foods, same with added sugars, limiting or removing alcohol, movement every day, typically in the form of aerobic exercise as well as strength training, and then of course rest and recovery, a solid sleep hygiene program, as well as taking time off from weightlifting and from running when you've had really hard workouts, because when do muscles grow? when they're resting. Increasing your muscle mass helps you to metabolize glucose better, as well as preventing metabolic syndrome and all of those things that are associated with increased cardiovascular risk. It's not one lever, it's multiple levers, and we're all good at some of those and not good at others, and you have to figure out which ones are most important for you to prioritize. We all have our own instruction manual, and you have to figure out yours. You saw your calcium score already,
Yep.
which really is the exact same category that you had before, right? Because it goes from 11 to 100, so it's
Yeah.
you're in the exact same place, no worse, no better, whatever. So this is the main blood vessel, the aorta, and this is taking slices through your body like this,
Okay.
actually from the feet up.
Okay.
Is how this works, in little slices,
Okay.
like plates,
Yep.
if you will.
Cross
So if you
sections?
think cross sections, exactly. And so this allows me to go based on whatever the thickness of those slices are. Every time you see the screen change, it's changing by that
Yep.
thickness, right?
And those are blood vessels over there?
Yeah, so this is your heart. This is the main blood vessel as it comes out of the heart, right?
Mm-hmm.
And this is the aortic valve, the main valve as the blood comes out of the left ventricle here, okay?
Yeah.
So then the coronary artery is lived just above the aortic valve. This is your right coronary artery coming off here.
Yeah.
Looks absolutely perfectly clean. You've got one little speck of calcium in there, but it's like minor, minor, minor. Still following it over all the way down. There it is, little speck of calcium right there.
That's it?
That's it. That's the only calcium you have in your right coronary artery.
Is there no way to get rid of that?
No. And you don't need to. It's not, that's not really an increased risk factor for
Okay.
you. We all get some. There's something called a fatty streak, which is
Yep.
a cholesterol buildup that you have as a newborn many times.
Oh, really?
In the backside of your aorta. So it's like there is a certain component of this that's just a natural physiologic process as we age.
Okay.
It doesn't mean, it's not causal. Just because you have a little calcium doesn't mean it's going to cause a heart attack.
Got it.
Just means you have a little calcium. So this is the left side of the heart. This is the left main coronary artery as it comes out. This is the left anterior descending artery here. And you've got these little tiny specks of calcium. Now there's no dam. This is your lungs, and
Yep.
so just like that, the contrast they put in your IV
Yeah.
is in the heart. Well, it's going to go out into the small blood vessels here as well, right? Looks really good.
So
You should be very pleased.
it's so strange to see this.
The insides of your body.
Yeah.
it
It
is.
makes you feel super vulnerable.
This little dark rim right here.
Yeah.
Yeah, that's all your fat. What's your body fat percentage? When's the last time you checked it?
I don't know. Low.
-2.
No.
It's
It's like
non-existent.
I mean, literally, it's got to, your body fat composition has got to be like 6 or 7%.
Well, I can tell you this, like I fucking put a big effort into like eating right.
It's impressive. I don't know that I've ever seen like a delineation of lean muscle and lack of fat. That's the fat. That's your skin, and you're right on muscle. I mean, it's sick. You kind of embody the type of validation that is really meaningful. Because like to see this is great, right?
Yeah.
To see what you're doing on the scale is great. But real validation that what you're doing is working is that when you miss your run,
Yeah.
you're miserable.
Yeah.
Because you know that the pain
That's
of
right.
missing it
That's right.
is greater than pushing through and getting it done.
That's exactly
And so
right.
that then goes back and forth with sustainability and consistency and all
Yep.
those things. So the true validation is that the fear of missing is greater than the pain of doing.
Yes. Yes. The fear of failure and not like taking
100%.
care of myself and like.
And so this is helpful, but this is like, okay, I climbed to the top of the mountain, now let's go to the next mountain.
That's right.
But understanding that mindset and really knowing that that's where you are, I think is a validation that you're on it.
Oh, for sure. For sure.
You know.
What did he made me nervous. What's he saying about the prostate scan?
Nothing to be nervous about. He was just talking about the quality of it because
Oh,
you got so much
You got some contrast
already,
from
and-
this.
I
And
gotcha.
it washed it out a little bit in the prostate, and it's funny, it kind of signals off of the fat in your body.
Yeah.
The scanner and
Yeah.
the software, and because you had so little fat, it was hard to get the reference signals.
I gotcha.
And so it made it not as perfect as maybe they are. But
My
like-
main concern is like make sure it's not too enlarged. So the
I don't know.
the calcium score is going to be a little bit higher.
It sounds like it. Yeah, just because they didn't include that little speck in the right coronary.
Yeah.
It's not going to change it significantly.
Literally has zero body fat.
Calvin, Ken Rideout.
Hey, what's up,
Calvin, how are
brother?
you?
Good to meet you.
Yeah, nice to meet you.
No, we were just looking. He has no body
Yeah,
fat,
yeah.
like none. It's pretty interesting, but because the MRI wasn't able to signal off of the fat in the pelvis, so
I
he didn't
see.
get as great of a study. And
Right.
there's a little washout going on with the contrast from his CTA first.
Okay, gotcha.
It's,
Gotcha,
it's,
gotcha,
just,
gotcha.
it's not ideal, but go ahead and just take a look.
We're looking at the prostate MRI here, and what we're looking at here is your bladder here, which looks normally got some contrast in it from that other exam.
Can you explain to you that you're looking from his feet up to his head?
Yeah,
Basically,
so we're
it's
kind of
like a
looking
loaf of bread.
at kind of the cross section. If you were to cut down here,
Yep.
going from your feet up to your head.
Got it.
Okay, so we're here kind of at the level just below the bladder here, and we're seeing urethra here, and then we're seeing the prostate gland. And the prostate gland has kind of two main components. You have this peripheral component, which we call the peripheral zone, and then the more central, which is the transitional zone here. And you see a couple little cysts here in the transitional zone, which is what we call benign prostatic hyperplasia, or BPH. That's kind of just a normal finding of aging of prostate
But
cancer.
nothing that would justify any kind of procedure or require anything out of the ordinary.
Not at this point.
Oh, good.
No, only if you were having urinary symptoms related to the BPH.
The only thing I have is frequent urination at night sometimes, but I have a feeling it might be tied to anxiety. Like I was, for a few months, I was waking up like 3 to 5 times a night to pee. Usually the first one around between 1 and 3, and I go to bed around 10, sleep. And then I would start waking up and I'd pee every time. And I wasn't forcing it, it wasn't dribbling out, it was like legitimately peeing. And then they put me on anti-diuretic hormone. And that's been working, and now I'm like once, twice max, and it's working. But my concern was like, okay, the ADH, maybe that's just masking a bigger problem. But if this isn't an issue, then at least I've eliminated one thing that could be causing the issue. So maybe it's just drinking too much fluid during the day, because as a result of all the running and training, I tend to drink a ton of water.
Right, and we're also not seeing any secondary signs that your bladder's under pressure. So your bladder wall is just like any other muscle. You can train it. So if it's pushing against resistance, say your prostate,
Yeah.
this wall will start to get thickened as well. Or you can
Okay.
get little outpouchings, which are called diverticula.
Yeah.
And we do not see that either.
Excellent. Thank you for the good news.
Alan.
Appreciate it. Oh, what a relief.
See?
Yeah, close that when we got
I literally was sitting there sweating. Oh, I'm the worst patient, man. I'm such a big pussy. Jack, you're the best, man. Thank you.
Appreciate it.
If you ever come to
Nice meeting you.
Nashville
Hope
and
to
I
see
can
you
help you with anything,
Thank
you
you.
let me know.